Hello, Give Methow. This is David Lefevre, the Executive Director of the Methow Valley Interpretive Center, and it is my immense pleasure to introduce Cindy Button, the Director of Aero Methow. Cindy, could you tell us what is the mission of Aero Methow?
Good morning. The mission of Aero Methow Rescue Service is to provide excellent out-of-care emergency medical care and transportation for the Methow Valley and promote injury prevention and well-being through education.
Wonderful. That sounds like a very relevant line of work, but could you tell us what is the relevance of Aero Methow Rescue Service today in the Methow Valley?
Yeah, I'd be happy to, and try to keep it within 2 minutes, which is going to be difficult. Well, first of all, I spent probably a half an hour this morning setting up my scene, so it was just perfect. And then shortly before I gave my interview with David, we got a call, so I lost my backdrop, and I apologize now for that. But it shows that. No matter what, we're ready to respond. We're ready to respond to the community's needs. And our latest tagline, actually it's our tagline, for lack of a better term, started in 2014 with the Carlton Complex. And we jokingly say, who are you gonna call? Because people will call us for everything related to the wildfire. Where do we take animals? What do we do? Where do we go? Where's food? Where's water? Where's shelter? And it's evolved to the COVID crisis, where now our phone rings constantly with COVID-related questions. Where do I get a test? I'm with somebody that had a problem, even though that's technically not our role. We do respond. We respond immediately, that we answer our phones if we're here during business hours, and if not, we respond with the ambulance if it's an emergency. Our main mission is of course to quickly respond and take care of people when they're sick or hurt, but that's expanded into prevention, education, preparedness, working through the variety of crises that our community faces, whether it's a natural, the pandemic that we're facing now. So that's our main purpose and why we need to be here. Probably the most important thing is that our valley is rural, it's remote, and it's geographically isolated. And therefore, we don't have 24-hour clinics, hospitals within our community. They're all between 30 and 45 miles away if you live in Twisp, and even further if you live in Mazama. So oftentimes people call us to just help them navigate where they should go. They're sick and they're injured. They don't know whether they can wait till the morning or they need to be taken care of tonight. And now during our pandemic, the hospitals are understaffed and full. And if you don't have to go to the hospital, then that is a better scenario for everybody, that we can take care of you at home. And we have a contract or agreement with Okanagan County Public Health with COVID patients that we can go check on them and make sure they're okay every day. So we have a great collaboration and cooperation with all of the healthcare partners in the Methow Valley and in the Okanagan Valley. So basically, we're relevant because we are the ones that answer your call.
Oh, thank you so much, Cindy. I was really moved by your words and the work that you guys do. And what it made me think of was how so many of the nonprofits in the Valley, really all of them, all of us, we're all responding to what's needed. I feel that way with the Interpretive Center, responding to fire relief efforts that we've been doing the last couple of years on the Colville Indian Reservation.
Yes.
That's not necessarily the work we've done in the past, and yet it's wanted by communities. And so we're saying yes. And that's what I'm hearing from you. So thank you so much for what you do.
And I love what you just said. And some people get slapped around by doing what they call mission creep. And I think that mission creep is essential to be flexible and respond to the needs. And I think what you're doing with the wildfires is just, it is also just very, I guess I can't think of another word than heartwarming. It's like we stepped out of what we thought we would do and we're responding. So yeah, that's just amazing. Oh, good job.
Thank you so much, Cindy.
Good job.
Keep up the good work.
Same to you.